The Home Affairs Select Committee has come up with a number of sensible suggestions in its recent report and recommendations saying that addicts should receive treatment for the breaking of county lines, prescribing of drugs for addicts and medicinal cannabis. It also points out it's a mistake to classify drugs for political rather than safety reasons. Highlights the fact, which is quite interesting, that the government tends to accept the Advisory Council on the Misuse of Drugs recommendations when they to upgrade a drug's categorisation, but are often reluctant to follow downgrading recommendations. Overall, it was a serious contribution to the debate, and there is a genuine problem. Look at this chart from the report. It's on page 82, I think. In England and Wales, the death rate's been flat pretty much for the past 20 years. But in Scotland, it's gone up and is now about 5 times that from England and Wales. So there is a real problem with drug use in parts of the United Kingdom. But there's also a fundamental confusion in the report about the different types of drug use and the solutions that may or may not be appropriate for them. Because we need to divide up those people who take drugs and their reason for taking them. Some people are addicts and they need treatment, and the report mentions the British system, which was used up until the 1960s, whereby registered addicts were prescribed with the drug that they needed. And there are still about 200 people in this country who are prescribed heroin, receive diamorphine on prescription as part of the NHS because they are addicts. And these people need sympathy, support and treatment, as do those whose drug addiction is mental health related. Those people similarly need treatment and help. But there are also social users, and here the law must be enforced heavily. The report has a section saying that drug users shouldn't be stigmatised, but social users must be stigmatised. They should be stigmatised in the same way that drunk drivers are. It should be as socially unacceptable to take recreational drugs as it is to drink and drive. Why? Because it funds a whole system of criminality that makes it easier for those who are addicts who need support to access drugs. It supports and helps the wealth of criminal gangs who are running the county lines and so on. So when the report recommends the idea of quality testings at festivals, this is simply a method of helping social users break the law with impunity. It is quite the wrong approach when drug use, or not drug use, but drug ownership is illegal. So we need a two-pronged strategy that recognises this distinction between addicts and social users, treatment and prescription for addicts, and law enforcement against social users. Until we make this difference, we won't protect addicts because of the link up with the criminal underworld. But equally, we are letting the social users get away with murder, literally, not metaphorically. People die because of the drugs trade, because of illegal drug usage. So we need to be clear on the legal status of drugs. They are illegal. And special drug testing zones will create hubs in which the law is suspended. But Parliament has legislated that drugs are illegal. And it's not up to lobby groups or festivals or the police to decide the law. It's up to Parliament. And as the report says, the main piece of legislation controlling drugs in the UK, the Misuse of Drugs Act 1971, is more than 50 years old. It is needing reform. But that reform has to come from Parliament, not from pressure groups. And it was that act that criminalised possession of drugs. And yet such prosecutions are incredibly rare. We may need to review the law, but until it's changed, it must be enforced.